Welcome back. Our next guest is trying to help improve your smile, especially for those who have been trying to hide their smile for years and years. And joining us once again is Dr. Richard Aguila of Jacksonville Dental Specialists. It's so good to see you. You're here to talk about something called hybrids. You say that really can transform not only a lot of smiles, but also people's whole outlook on life. Because sometimes when they don't look and feel their best, they don't really go out and enjoy life the way they could.
Exactly.
So let's talk a little bit about that. First of all, what Highbridge is all about.
Yes. Highbridge was actually started by a couple specialists over in Rochester, New York, and they developed treatment protocols and philosophies and developed a network of providers nationwide that has provided over thousands of Highbridge prosthesis for patients. And in order to be in the network, you have to either be a dental specialist, okay, with the skill set and training of implant dentistry, or highly skilled, highly trained general dentist. So there's a certain skill set that you have to have. The majority of the people in network, or providers in networks, are prosthodontists, periodontists, and oral surgeons. And in our office, we work as a team. I am the periodontist, so I am the surgical specialist. My partner is Dr. Matthew Naraki, who is the prosthodontist. So we work as a team in one facility to provide, complex, to address complex dental problems for patients. Right,
and to have that specialty, I'm sure, is peace of mind for your patients as well. And talk about the safety component of it too, knowing the patient, knowing that when they come to see you, that they're safe, and this is a procedure that you do quite a bit.
Yes. Safety is a very high priority at our office, and part of the safety is the fact that we have specialty training. We both did residencies in periodontics and prosthodontics, so we treat the most difficult cases. We also have the most recent technology available, cone beam CT scans to evaluate the bone. We have treatment planning software that allows us to do virtual surgery prior to even sitting down and doing the surgery. So these are all things that we've incorporated into our practices to allow us to provide this in a safe and efficient manner for patients.
Let's talk about who gets the procedure. Are these people that are suffering from what? I mean, is it a matter of how many teeth, or how does it work?
The majority of the patients that see us are for complex dental problems, full arch cases where they're having periodontal problems or teeth problems throughout their mouth. But what patients don't know, we also do localized treatment. In this particular case, we did implants in the lower anterior, and it just takes a couple implants, and we can provide a prosthesis in the front that looks really nice and functions for a long time for patients, if not indefinitely. In the back, we're more concerned about function, and we can also place a couple implants to provide an implant bridge. So not only do we do the full arch complex cases, we also do the limited localized cases in the front or the back that involve implants.
Okay. Well, what would you say to some people who say, you know what, I'm just getting too old. I'm not going to come in. I'm not going to do this. Why should I do this at this stage in my life when I've been dealing with it for a long time? I'm used to it. What do you say?
We hear that story all the time, and what I like to tell patients is there is no definitive age contraindication to doing implants. The baby boomer population, there are going to be more and more of these people that reach the age of 90. So age is typically not a contraindication. We always tell patients, you've taken care of your children, you've taken care of your grandchildren, now it's time to take care of yourself. It's a quality of life issue. If you're 50, 60, you can realistically expect to live another, 20, 30 years in today's, society. So we like to tell patients, if it's important to you, quality of life is important to you, invest in yourself, and you'll be happy that you did it.
There you go. And you can do so, you say, by taking the first step to come to one of your seminars to ask questions.
Yes, we have a monthly seminar. Our next one is next week, I believe, on the 17th of May. And we talk about implants. We talk about other services that we provide. You get to meet the staff, you get to meet the dentist, tour the facility, have us answer all the questions that you have ahead of time. And then from there, you're granted a complimentary consultation to see us and see what we can do for you.
All right. Good to see you.
Okay,
As
thanks
always,
for having me.
appreciate your time. And thanks so much to Jacksonville Dental Specialists for coming on and making the segment happen. You can call 904-460-4201 to schedule a consultation, or you can visit their website to learn more, which is jacksonvillehighbridge.com. Well, coming up after the break, Rick